Okay, so when we come to apply the tape, there's a few things that you need to be aware of, okay? The first is that you need to make sure the skin is clean and dry, no oil, lotions, all that sort of thing. It really doesn't like that. Most of these heat activated glues don't, so you need to clean that. Secondly, hair as well. I tend to have a set of clippers that we use that takes enough hair off that it will stick really well, and you tend not to get a reaction from the razor, from the clippers, which you often will with a razor. And if you get the right ones, most of these have a head that can clip off, so you can use that for infection control and clean it and so on as well. Okay. As I mentioned, it is a heat activated glue, so in the cooler weather it's not a bad idea to actually give the skin a bit of a quick rub first, just to heat it up before you apply it, and then stick the tape on, and then heat it up again afterwards, which we'll go through in a moment. Now the key when you're applying it, we touched on a little bit earlier that you can get a mechanical irritation. Now with tapes you'll get three sorts of reactions. You can get an allergic reaction. Now they generally happen really quickly within the first half an hour or so. It can be longer, but generally fairly quickly. And they will get hot and itchy, and when you take it off there'll be that red raised typical allergic looking response, and it will be all over because it's going to be a reaction to the glue. The second type of reaction you can get is a contact dermatitis, and you see that more with your Fixamol or your Coverall and your Luca tapes or your rigid athletic tapes, where they stay a bit damp underneath and moist. You have that moist environment for a few days, you take it off and the skin looks quite gungy and horrible. We don't tend to see that with this because it dries really quickly, it breathes really well. If you actually hold it up to the light, if you hold that up to the light, you can see straight through it. Really breathable fabric, dries within about 5 minutes of getting out of the shower. So we don't tend to get those. The problem that you will get, particularly people have this when they first start out if they get it wrong, is a mechanical irritation. Now again, you can have that from any tape pulling on the skin for any length of time, but because we are using this to pull, we're basically looking at the body as a system of levers, and we're using this as a big rubber band in between to pull on them, right, to either decelerate or to accelerate. So the potential is probably greater with this if you get it wrong, and so we'll explain now how to get it right. The first thing with those reactions, they look quite different to your allergic ones, and they tend to take longer to come on, maybe 10 to 15 hours, might even take a few days depending on how much tension's in the system. And they will usually be isolated, a reaction at the ends or at 1 or 2 points along the length of the tape, but they won't be all over like that allergic reaction, because they're only going to be where there's been too much shearing on the skin. So to say, it's usually on the ends, but it might be that you've gone across the back and maybe anchored and turned the corner or something, and it's come on there. Okay. And they look more like a blister, What they start off as a bit of a hypersensitivity. You'll just feel that it feels a bit sensitive, and if you leave it, it continues to get a bit of an itchy, stinging sort of feeling as you're getting this incipient blister, and if you leave it beyond that, it'll start to break down, you get like a blister. Okay. Now you should never get any of those reactions, because if you warn patients correctly, so when you put it on, you warn them, if you get any itching, stinging, burning, irritation, you may be at risk of getting a reaction. Remove it. Okay, and that goes for any of your tapes, not just this stuff. Similarly with the sprays, I see more reactions with using adhesive sprays than I do to the tape itself. So just watch, if you are using something that looks like it's an allergic reaction and you've used a spray, just check and see, do a little test patch of spray or a test patch of tape to determine which one, because it may in fact have been the spray. Okay, so then when you go to apply it, in fact let's just do this as a little technique. We'll just take our scissors here. We'll just cut this into 3. Now normally you have the backing sheet on still, right? But we're just using a piece that we've already played with. Okay, so we'll cut this into 3, and this is just to help your wrist and finger extensors. So what you need to do is actually apply the anchor points on here without any tension. Now I'll just do it from the other end to start off with, just to show you. We don't normally do this, but generally you want to have somewhere around 3 to 4 fingers width, 4 or 5 centimeters, a couple of inches, that doesn't have that has no tension on it. Okay. Now often people get that part right, but then they go and do this, and you can see there how all of that tension is still coming through and in onto the skin. So what you need to do is actually apply that 3 or 4 fingers width down, hold the end out, and then actually put your tension on. Okay, and that way, when I tension it, you don't get any force being transmitted through into the attachment. Okay. Now, I'll just take that off. So then you apply one end, hold it, just put your tension on, and then you apply the other end 3 or 4 fingers width again without any tension. The question then comes, how much tension do you need, right? Now this tape has been designed really specifically, and it's a really neat fabric. It's a viscoelastic fabric, okay, which means that in practical terms what it means is that it's most elastic, or it has better energy absorption and recoil in and around that starting position. Okay, so we're not trying to limit. You've got to get out of the mindset of thinking of locking stuff up with your, like you do with your rigid stuff. This shouldn't feel really tight. It should feel springy, if you like. And so we actually want this to function in and around this starting point where we're going to get this good energy absorption and recoil. Okay, if we go too far, what will happen? It will feel more restrictive, but we don't get the same load absorption and return from it. Okay. Now, what it also means is it's going to be putting a lot more tension on the skin. The reason we also don't need to do that is we create the tension from the position because we're putting it on in a short position. If you're thinking my elbow flexion, if I put this on in a short position, I really only need to take it to the very onset of resistance, which is pretty much straight away, because as soon as I move, that's going to create resistance as the tape stretches. So I only need to actually stick it on with pretty much, when you're starting out, it's not even a bad idea to stick it on with no extra stretch on it. Just actually put it in the correct position. So in the short position, often it's the corrected position, no tension, and let the position or the movement create the stretch. And as it does, that's going to create that deceleration or that load absorption, store it at the end, spring you back again. Okay. Now the glue has been designed very specifically that if you have too much tension, it's actually designed to start coming away at the ends, so that you reduce the likelihood of those reactions. Now, of course, it's a bit of a grey area. We want it to stay on really well if you get it right. So there's a bit of a grey area there where you get a bit too much tension and it manages to hang on, and you may get those reactions. So that's why it's important that you always warn your patients. The other reason you don't really need to stretch it much is that, as I was starting to say, it's a viscoelastic material, which means, one, it functions best in and around here, but it also means that the amount of resistance is dependent on the rate of strain. So what that actually means is that the faster we stretch it, the stiffer it becomes. Okay? So if you've got people throwing, running, jumping, even walking, doing things with greater speed, you will get more resistance from the tape purely as a result of the nature of the product, of the nature of the fabric. Okay? So don't be tempted to try and generate more force by overstretching. If you want more force, then you either go for another strip in parallel or a wider strip, or you do your power bands and you laminate it together beforehand. Okay, so once we put it on, so just a few things that we didn't mention in terms of applying it. Always round your corners off, okay, and you just clip those off, and that just stops them from lifting so easily. If you can avoid touching the glue, obviously it's going to stick better. This glue is about 20-25% stronger than most of the other products around, but we are using it in a more demanding way, so it needs to be. So the way you do that is just tear the backing sheet and just give it a slight pull, and you can actually get the backing sheet off without actually touching your adhesive, and then you can apply it to the body without touching it. Okay, even putting on your anchor point there without any touching the glue at all. Hold down. Then, to handle it, just peel the backing sheet back on itself, and if you hold that between your thumb and your fingers, you usually got really good control of that, and you can actually anchor, smooth down, and then stick the other end on without any tension at the same time. You don't get yourself too tangled up. Okay. Now, let's just go back to this one. We'll do very quickly. So, as I say, we don't have the backing sheet on. Normally we'd round all these corners and things, which we haven't done here, but let's slot that on. Okay, so no tension on those points there. Then we bring you into that short position, okay? And then just smooth down and come up, smooth it down as we go, and then as we come over the olecranon, if there's, say, a tennis elbow, we could actually gather that up and do a bit of an offload. Now all we then need to do is just pull you slightly forward, and all of this is going to come down and stick on, okay? And then just hold it and use the pressure and the heat of your hand to set the glue off, okay? Now this is one that we've played around with quite a lot already, but you can see if you actually use the pressure and the heat of your hand, it will actually set that glue off really quite well, I don't recommend that you do it half a dozen or 10 times before you stick it on. Try and just do it once. But it is pretty sticky stuff once you get it right. You do need to hold it down though. You need to prepare the skin well, as we said, and you need to hold it down and let the heat and the pressure bond the glue, okay? There are products around, you can use some of your adhesive sprays to give you better adhesion. We're actually bringing one out ourselves. It's a really sticky one, great for the water and those sorts of things as well. If you need to, just be very pragmatic about it. If you need to lock around the ends with a rigid athletic tape or something like that, fingers are going to go in and out of pockets and things like that, you might find you want to do something like that if you need to, okay? Once it's on though, hold those ends or any of these sort of hollow areas particularly, and then give it a really good rub for a good 30 seconds to a minute. The longer you do it, the better it will stick, basically, okay? Make sure you then warm the person really well. Okay. Now when you go to take it off, the key with that is to actually peel it back on itself. So peel back, don't lift up. If you lift up, again, you can feel the extra pull on your skin. Yep. More force required to remove it, more trauma to the skin potentially. So hold it down and peel the skin back along itself. Okay. So when you're putting it on, you're holding down and you're actually pulling the skin back as well and just lightly tensioning it. When you come off, same thing. Think of the skin. This time we're going to pull it in the opposite direction. Peel it back off itself. Okay. In that direction. Okay. The big thing is to get good adhesion at the outset. If you get good adhesion, it will last you several days, no problem. Okay. Make sure you warn your patients very well though that they do remove it within that time. Don't tell them that they have to leave it on for a few days. Okay. Tell them that they may if it's not worrying them at all, but if it does get itching, stinging, burning, irritation, their pains will, excuse me, to remove it. Okay.
If they have no issue, there's
no issue. There's no worries to leave it on, providing it's not worrying them. If they feel as though it's a benefit, it will depend on what you're trying to treat as well. Some things you may only want on for a training session or a match. Some things you may want on for several days or a week even, depending on how it lasts. Some parts of the body last better than other parts. Big, long, straight back ones last really nicely. But if you've got a footballer and you're going around his knee and he's going to do a lot in it, you might find it doesn't last quite so long, or some of your hand applications may not last quite so long. Okay. We try to limit the amount that we overlap the tape. We don't run a 50% sort of overlap up through here like you would with a rigid athletic tape, because it gives you a big long edge that's got the potential to lift up. If you do cross the tape, try and cross it relatively perpendicularly, or make your power band 100% coverage before you stick it on. So, and let that laminate together before you apply it. You can also use your adhesive spray on the back of the first layer before you stick the second layer on, and that often improves the adhesion on as well. Just again, watch some of your adhesive swabs and wipes and things can be water-based, so they'll actually reduce your effectiveness in water. This stuff is really good in water if you give it adequate time before you go in, even without a spray, but you've got to allow a good hour or so before they go in the water. If you don't have that time, then go for one of your sprays, and as I say, the one we're just developing now is really geared around going straight into the water or straight into really vigorous exercise and still holding really, really well. Okay.
All right.
Now, I'll just quickly show you, there are lots of different techniques here. This is our quick start guide. Just go through a few of them. Even something like this at the back here for your arch support. It's a little bit of a variation on the theme, but we can basically create this false windlass mechanism where we're basically starting on the big toe. So as the big toe extends, it's going to tighten up the tape and basically shorten your arch, or shorten your foot and raise your arch. And some of the preliminary studies that we've been doing looking at this tell us that we get a shortening and a raising of the navicular somewhere in the magnitude of between 5 and 10 millimeters. Okay. I tend to use a double layer there so that it maintains that really, really well.
Power band.
Power band, but with the 5 centimetre, the 2 inch rather than the 3 inch. And so what that means is they can still get all the way down into pronation, so they can still absorb load, they can still accommodate to surfaces and things, but they need to push through the tape essentially to get there, or the body weight needs to. So it means that the tape is providing some of your deceleration force of that navicular drop, and then as they come over onto their toe, it's actually going to be stretching the tape and providing this active resupination as they come over the top, sort of to release again. So There's lots of variations in here. You can look at, simple things like doing the calf, or, using the energy in the tape to resist our patellofemoral motion, so that, again, still allowing full range, but as they come into bend, we're slinging around this patella to tighten it up to provide a resistance to lateral motion. So we're doing some of the work, if you like, both at the quads mechanism, but also we're helping VMO by providing another force that has to be overcome for the patella to track laterally. Okay. Look, the more you start playing around with it, the more you'll find opportunities to use it. Those guidelines in terms of applying it and things are all in this guide, and also come in the boxes as well. When you buy a box of 6 or a box of 4 of the 3-inch 7.5, you'll actually get this in there. So if you do have any problems, just go back and review that, or by all means contact us, and we will try and troubleshoot that with you, because it's usually something very, very simple, and once you get the idea, you don't have any problems after that. Okay.